Aloha, everybody. Happy Aloha Friday. Yay, we made it through another week. And it's been a while since I've done my lives, but here I am. And guess what our next 30-day challenge is? Are you excited as I am about this? So it's going to be 30 days of flossing. Do you love this idea? Do you hate it? Why did we decide this? Well, first of all, a few people wrote to us and said, this would be a great challenge because I hate flossing. And if I have a challenge in mind, maybe I'll start flossing. And from the doctor-patient perspective, the more that I see people flossing, the less dental work they need. So listen to that again. The more they floss, the more they put this little string between your teeth and clean out all that food, usually the less dental problems you have. I would say almost always the less dental problems you have. So why do we need to floss? So I got some little props to explain the importance of flossing. So if you think about food, you have a sandwich, a piece of toast, a cracker, a cookie. Some of that stuff gets stuck in your teeth. And so you might not be able to see it, but it's in there between the teeth. So it might be like this, kind of smashed in there. Can you see that? See, there's some stuff stuck in there. So when you brush your teeth, you're brushing these surfaces here, right? You're brushing the occlusal, we call the biting surfaces, the lingual surfaces, and maybe the inside surfaces. But no matter what, there's always some particles, some plaque, what we call plaque. It's like this icky biofilm that gets stuck to your teeth that ends up sticking to your teeth over time. It gets harder and harder with the calcium in your saliva, and that's when it becomes hard, like called calculus, which is like a barnacle stuck to your teeth. And then I or another dentist have to go in and scrape this stuff off. So you can see it's really soft right now, right? Pretend you just had your cookie, cracker, sandwich, candy, whatever. And you can just go in there with your floss. This is our awesome biodegradable Aloha floss. We can just go in there, and when it's soft, we just clean it out. It's super easy. Just get in here and you just start cleaning all this stuff out, right? So you can see, for example, this is what comes out on your floss. So if you didn't floss, all this stuff is sticking to your teeth and staying in that little pocket between your teeth and your gums. And guess what happens then? Inflammation. That's what gingivitis is. Gingiva is your pink gums. Itis is inflammation. Gingivitis, inflammation of your gums. And just like inflammation anywhere else in your body, when it's in your mouth, it does affect the rest of your body, because if there's bacteria in your gums, right at the gum line, that's vascular, right? There's a blood supply there. So that's circulating back to your heart. So it's so important to get that bacteria out of our mouths, out of our body, reduce the inflammation in our mouth and in our whole body, and keep our teeth happier, our gums happier, our heart happier. The cleaner your teeth are and your gums are, the cleaner your whole body and your heart is. So I think what we can do now is start a 30-day flossing challenge. And if you guys hate flossing, fine. Just start with once a day right before you go to bed. What I do, I leave my Aloha Right floss. I leave it in my shower, in my bathroom, in my car. I just have it everywhere. So no matter what, I always have floss on me. I have some in my purse. We have a little mini floss. Do I have one here? Yes. This is our little mini floss. It's totally zero waste. See, it's in a little paper package with the floss, biodegradable floss. Just keep this in your purse or in your wallet or in your pocket, whatever. And keep it around and you will see the difference. And if your gums start to bleed when you start flossing, don't worry. Unless it's a lot of bleeding, right? Then go to your dentist, call your doctor. But if it's just a little bit inflamed and there's some bleeding, that's normal, because if you have inflammation in your gums, the first time you go in there and start cleaning them out, they're going to react. They're going to get angry and say, what are you doing? But just get that gunk out of there, and then everything's going to start healing. You're going to feel better. You're going to look better, and your breath will smell so much better. And I can tell you, when I see somebody and they're not a flosser, I can tell right away. You might think my teeth look great, I'm bleaching my teeth, or I have veneers, or I have crowns, whatever. But guess what? People can tell when you don't floss, and your breath smells so much worse because that bacteria that gets stuck between your gums just stinks. It stinks, stinks, stinks. And so sometimes when I'm cleaning people's teeth, if there's a lot of hard calculus and a lot of plaque, it smells so bad. And why is that? It's because of all the bacteria that's causing all this inflammation, and you've got to get it out of your mouth and get it out of your body, and you'll feel so much better. So let's start today. Today is, what is it? March 8th, 2024. So let's do 30 days of flossing once, maybe twice a day, but at least once right before we go to sleep. Are you with me on it? Do I got some thumbs up? Yes. Okay, great. So if you have any questions, like always, just call me. If you have my number, I guess you can text on Instagram or Facebook or YouTube or all of these things. Feel free to send me a message if you have questions. And I'm so happy to talk about the importance of flossing. I love floss. I think it's amazing. Oh, good question. Water pick. Water picks are totally awesome. It's like a power hose for your teeth, right? You can just get in between there. The only thing is the water pick, it's like spraying down the teeth, right? We're getting to all of these surfaces, but still that tip cannot get between the teeth. So I have a lot of patients that use the water pick and no floss, but there's still all this plaque that gets stuck between the teeth, which turns into calculus. And so then I have to get an instrument, scrape it off, and that's not fun for anybody. So floss more, go to the dentist less. Well, still do your annual whatever cleaning visits and everything. But what I'm saying is the more you floss, the happier your teeth will be, and hopefully the lower your dental treatments will be. So less visits to the dentist overall. So have a wonderful, happy Aloha Friday. Have a great weekend, and I'll see you guys soon. And I look forward to all of your messages. Aloha.